Another lesson, another drug. Hey there everyone, it's been a while. And for today's video, we will be talking about the autobiography of the drug hydroxyzine. The generic name of the drug is hydroxyzine. Its brand names are Visatril, Visatril IM, Hyzine, Vistagec 50, Resin, ANX, Atarax, which is no longer in the market, Hypam, no longer in the market, and Orgatrax, which is also no longer in the market. Its chemical name is C21, H27, CIN202.
For the drug classification of hydrocyzine, its therapeutic classification is it is an antihistamine, piperazine, and a derivative. Its pharmacologic classification is it is an antisiolytic, it is a sedative, an antipyretic, antiemetic, and it is also an antispasmodic. Hydrocyzine has been assigned to pregnancy category C. Its use should be avoided during pregnancy. Hydrocyzine in the first trimester increases the risk of fetal defects. It can also cause hypotension, myoclonus, hypoxia, and central nervous system depression. In animal studies, hydrocyzine was teratogenic.
The mechanism of action of the drug. The H1 histamine receptor is responsible for mediating hypersensitivity and allergic reactions. Exposure to an allergen results in degranulation of mast cells and basophils, which then release histamine and other inflammatory mediators. Histamine binds to and activates H1 receptors, which result in further release of pro-inflammatory cytokines such as interleukins from basophils and mast cells. These downstream effects of histamine binding are responsible for a wide variety of allergic symptoms such as pruritus, rhinorrhea, and watery eyes. Hydroxyzine is a potent inverse agonist of histamine H1 receptors. Inverse agonists are agents that are considered to have a negative efficacy, so further than simply blocking activity at a receptor, they actively dampen its activity. Inverse agonism at these receptors is responsible for hydroxyzine's efficacy in the treatment of histamine edema, flare, and pruritus. Hydroxyzine is not a cortical depressant, so its sedative properties likely occur at the subcortical level of the CNS. These sedative properties allow activity as an anxiolytic. Antiemetic efficacy is likely secondary to activity at off targets.
As for hydrocyzine's pharmacokinetics, for its absorption, it is absorbed rapidly and completely after oral administration. Serum levels peak in 2 to 4 hours. Sedation and other clinical effects are usually noticed in 15 to 30 minutes. As for its distribution, it is not well understood. For its metabolism, it is metabolized almost completely in the liver. As for its excretion, metabolites are excreted primarily in urine. Small amounts of drug and metabolites are found in feces. Half-life of drug is 3 hours. Sedative effects can last for 4 to 6 hours, and antihistaminic effects can persist up to 4 days.
The drug's indication. Hydroxyzine is used to treat itching caused by allergies. It is an antihistamine and works by blocking a certain natural substance, which is the histamine, that our body makes during an allergic reaction. Hydroxyzine may also be used as short-term to treat anxiety or to help you feel sleepy/relaxed before and after surgery.
As for hydrocyzine's contraindications, hydrocyzine, when administered to the pregnant mouse, rat, and rabbit, induced fetal abnormalities in the rat and mouse at doses substantially above the human therapeutic range. Clinical data in human beings are inadequate to establish safety in early pregnancy. Until such data are available, hydrocyzine is contraindicated in early pregnancy.
Side and adverse effect of the drug. For the gastrointestinal effect, it causes nausea, loss of appetite, stomach distress, constipation, vomiting, and dry mouth diarrhea. For nervous effect, it causes seizure, tremor, nervousness, confusion, disturbed coordination, sleepiness, and headache. For ocular effect, it causes blurred vision, double vision, puffiness or swelling around the eyes, accommodation disorder, and oculogyric crisis. For respiratory effect, it causes dry and thickening of oral and other respiratory secretions, cough, respiratory depression, and bronchospasm. For cardiovascular effect, it causes fast heartbeat and irregular heartbeat, shortness of breath, tightness in the chest or chest pain, edema, hypotension, and ventricular fibrillation. For integumentary effect, it causes skin redness or rash, blistering or peeling, acute generalized exanthematous pustulosis, bullous condition, dermatitis, erythema multiforme, fixed drug eruptions, increased sweating, maculopapular rush, pruritus, Steven-Johnson syndrome, and urticaria. For psychiatric effect, it causes aggression, agitation, confusion, depression, disorientation, hallucination, and insomnia. For genitourinary effect, it causes dysuria, enuresis, and urinary retention. For hepatic effect, it causes hepatitis, liver function test abnormal, and for hematologic effect, it causes thrombocytopenia. And lastly, for metabolic effect, it causes weight gain.
These are the nursing responsibilities before administering hydrocyzine. A nurse should be certain of the identity of the patient before administering a drug and conform this with a wristband and ask the patient for the name and date of birth, as well as ensure that the patient is not allergic to the drug. The nurse should have a clear knowledge of medication to be administered, which is the hydrocyzine, its medical use, regular dose, reported adverse effects, and any specific contraindications or precautions associated with the drugs to prevent any untoward complications. The nurse should be familiar with the treatment plan of the patient and the need for the drug to be administered to the patient and perform a thorough physical assessment to establish baseline data before drug therapy begins, to determine effectiveness of therapy, and to evaluate for occurrence of any adverse effects associated with drug therapy. The nurse should also consider the dose, the route, and pacing recommended and equate this with their understanding and experience. The nurse should verify the drug's expiry date. Give IM injections deep into a large muscle. In adults, use outer quadrant of the buttocks or midlateral thigh. In children, use midlateral thigh muscles. Use deltoid area only if well developed. Do not administer parenteral solution subcutaneously, IV, or intraarterially. Tissue necrosis has occurred with subcutaneous and intraarterial injection and hemolysis with IV injection. Do not give medicine to client with prolonged QT interval. If the client plans to be pregnant or is pregnant. Do not give to client who is currently breastfeeding. Inform the client that medicine can cause drowsiness.
Nursing responsibilities during administration of the drug. Evaluate alertness. Drowsiness may occur and usually disappears with continued therapy or following reduction of dosage. Monitor conditions of oral membranes daily when patient is on high dosage of hydroxyzine. Reevaluate usefulness of drug periodically. Reduce dosage of the depressant up to 50% when CNS depressants are prescribed. Monitor response carefully when beginning therapy so that the dose can be adjusted accordingly. Provide thorough patient teaching to enhance patient knowledge about drug therapy and to promote compliance with the drug regimen. Provide safety measures to prevent injuries. The administration of the drug should be reported immediately in the patient's notes, clearly and accurately, with the nursing signing and printing their name and documenting the date and time the medication was administered. Nursing responsibilities after drug administration. Monitor patient response to therapy. Monitor for adverse effect. Evaluate patient's understanding on the drug therapy by asking the patient to name the drug, its indication, and adverse effect to watch for. Monitor patient compliance to drug therapy. Inform client to not drive or engage in other potentially hazardous activities until response to a drug is unknown. Inform client not to drink alcohol and hydroxyzine at the same time. Relieve dry mouth by frequent warm water rinses, increasing fluid intake and use of salivary substitute. Give teeth scrupulous care. Avoid irritation of abrasion of gums and other oral tissues. And lastly, consult physician before self-dosing OTC drugs.